we move to the next presentation that will be given by Dr. Tulic from Nice. She will speak about impact of house dust mite vitiligo skin, environmental contribution to increased cutaneous immunity, and flying melanocytes. So please.
Thank you very much. Before I'd like to begin, I'd like to thank the organizing committee for giving me this wonderful opportunity to present our latest data looking at the impact of house dust mite in vitiligo skin. As we've heard over the last couple of days, the mechanisms involved in vitiligo are multifactorial and extremely complex. They involve genetic predisposition, immune dysfunction, as well as environmental triggers. Vitiligo is characterized by melanocyte detachment or presence of suprabasal melanocytes in the epidermis. The mechanism is thought to be by disruption of E-catherin, which is an adhesion protein which holds the melanocytes at the basement membrane. And this is thought to be driven by metalloprotease 9. We asked the question, can house dust mite disrupt E-catherin in the skin? And could this be a potential trigger in vitiligo pathogenesis? You may ask, why house dust mite? We know that house dust mite is a component of healthy skin microflora. We know that it is a potent immunomodulator, and the mite feces are packed full of proteases, which we know for a long time have been involved in the destruction of tight junctions. DERP1, which is a major house dust mite allergen, is a known trigger of respiratory and gut diseases. And we also know that the cutaneous axis of mites in the skin causes skin dysbiosis and has been shown to be involved in pathogenesis of atopic dermatitis and acne. We also have heard over the last couple of days that there is comorbidity which exists between vitiligo and atopic dermatitis and asthma and gut diseases such as IBS and IBD. And interestingly, for all of these diseases, we know that house dust mite plays a critical role in triggering of these diseases. The latest evidence presented only a few months ago by Julian Seneschal's group has shown that vitiligo is not only a Th1, but it's also a Th2-driven disease. And we know that the house dust mite is an extremely potent activator of Th2 immunity in vivo. So the first thing we looked at is the immunoreactivity of DERP1. And we've shown that DERP1 is present in the healthy as well as in vitiligo non-lesional and lesional skin. We've used a skim from patients of atopic dermatitis and patients with IBS as positive controls. We've also been able to show that house dust mite indeed increases keratinocyte immune function both in vitro, in keratinocyte cultures, and ex vivo using skin explants, increasing the production of cytokines and chemokines which we know are typically involved in vitiligo pathogenesis. We've also been able to show that the house dust mite is effective in reducing the expression of E-catherin, and this is shown dose-dependently in vitro in keratinocyte cultures, and at the bottom in human skin, showing a reduction in E-catherin mean intensity following exposure. We've been able to show that this house-driven effect is on the E-catherin is specific to E-catherin, the adhesion protein, and not to other tight junction proteins such as ZO1, occludin, filaggrin, and claudin-1. It also seems to be driven by DERP1, as shown by its dose-dependent reduction in E-catherin expression. Moving on to the vitiligo skin, we've been able to show that these patients respond in a similar manner when we also compare to, as we've seen in healthy skin. However, and very interestingly, the vitiligo keratinocytes, when compared to healthy keratinocytes, seem to be much more sensitive to exposure to house dust mite. We've also shown is that house dust mite can indeed cause detachment of melanocytes in the healthy skin, which we look at on the right by semi-quantification of these detached melanocytes. And following exposure of healthy skin to house dust mite, we see detachment of melanocytes, which is similar to what we see in non-lesional vitiligo skin. And following exposure of vitiligo skin to house dust mite, we see a further detachment of these melanocytes and again destruction in E-catherine. This melanocyte detachment is associated with increased soluble E-catherine, which has previously been shown in the sera of vitiligo patients. So we asked the question, does house dust mite cleave E-catherine, and if so, what is the candidates? We looked at MMP9, and we've been able to show that indeed, dose-dependently, house dust mite causes an increase in pro and active MMP9, but not MMP2, and this was confirmed in keratinocyte lysates and in vitiligo patients. And we've also used immunohistochemistry to show that house dust mite causes an increase in active form of MMP9 in healthy skin, similar to what we see in vitiligo, non-lesional and lesional skin. We've been able to partially restore this E-catherine expression using MMP9 selective inhibitors, and this inhibitor can completely block the activation of active MMP9 due to house dust mite. We've also used a 3D healthy skin model to be able to show that indeed house dust mite can exhibit vitiligo-like features, showing degradation of E-catherine, detachment of melanocytes, increased insoluble E-catherine, increased expression of chemokines, and MMP9 activity. We use TNF and interferon gamma as a positive control because we know that this condition does indeed, in the same model, cause vitiligo-like features. And here we've shown that house dust mite can also have the same effect. Finally, we looked at the direct effect of keratinocyte secretome on human melanocytes, and we've been able to show that indeed the secretome can directly stress melanocytes, increase their immunity, and also cause activation of cleaved caspase 3, shown in Western blot, and immunofluorescence, showing their undergoing apoptotic state. So in summary, hopefully I've been able to convince you that house dust mite does have effect on cutaneous immunity, melanocyte detachment, and that vitiligo skin is a lot more sensitive than healthy skin in stimulation with house dust mite. The mechanism seems to involve reduction of E-catherine expression by DERP1 and MMP9, and these results was confirmed in vivo using 3D skin model and human skin biopsies. So our results beg a number of important questions, such as what is the impact of ubiquitous environmental mite on triggering flares in vitiligo? And of course, what is the implication of our results for those vitiligo patients who may be sensitive to house dust mite? With this, I would like to finalize and thank my colleagues and friends back in France, and thank Anen Bzouesh, whose project I'm presenting today. He was part of her PhD project. Of course, Katia Boniface and Julien Sénéchal, who were our great collaborators on this project. And of course, to you, Thierry, for continual support and enthusiasm for our projects. Thank you very much, and I thank you for your attention.
Thank you very much for this very nice presentation. I completely agree with your approach. This idea that environmental can produce some inflammatory mechanism in keratinocytes, vitiligo keratinocytes are more susceptible than normal. The keratinocyte for normal individual is quite interesting situation, just in view on the possible triggering factors for the appearance of the clinical manifestation. Any question or comments?
Thank you for that very interesting presentation. Patients always ask me what causes their vitiligo, and I said, 30% is genetic, but 70% is environmental. And the next question is, what is it in my environment that's causing my vitiligo? And so this is very interesting. Have you, maybe this is premature, but have you thought about clinical scenarios? For example, are there people who try to live in a dust mite-free environment due to asthma, for example, because of severe asthma, and do those people have a lower incidence of vitiligo? Or are there areas in the human body, such as the axilla, which are not exposed to dust mites as much as other areas? And do you feel like the axilla has a lower frequency of vitiligo? I don't, because I see it in the axilla all the time. So have you thought about kind of...
We sure have. And in fact, my background, I mean, I've been with Thierry now for 6 years, 7 years, and my background is in allergy and asthma. And this is why I asked this question, because we know that house dust mite is a trigger of asthma. We've known, house dust mite has been used immunotherapy to treat asthma for 100 years, the first immunotherapy. And yes, the treatment for severe asthmatics is to go in places like Davos in the Swiss Alps, where there is no house dust mite. Now, the reason we decided to apply this to vitiligo is because of this barrier problem and tight junctions and e-gathering implications. So we thought, well, let's give it a go, and it makes sense actually. Yes.
So people getting injections of house dust mites for their asthma, if they're doing that, they should have a lower incidence of vitiligo, right?
It's very early. We don't have any of that data.
Asthma is antibody. It may be a different mechanism of action compared to vitiligo.
Absolutely. I agree with you. Yes.
Hello, good afternoon. I am also observed a few cases of pediculosis of scalp, followed by some patients, some vitiligo patients, non-segmental vitiligo. Few patients, especially younger girls, have seen pediculosis of scalp. Is coincidental, or after watching your speech, so it's coincidental, or it may be allergic related to this vitiligo?
I am really sorry. I'm not sure that I understand the question.
Yeah, if you believe that there is a possible correlation. He described a case with coincidence appearance of segmental vitiligo with pediculosis of the scalp. If you believe that could be some coincidence with some allergy and the appearance of vitiligo, basically, I think that is also the reason.
Yeah, absolutely. We now know that there is also Th2-driven immune response now in vitiligo. There is more and more evidence coming out. So there is still lots of research, of course, to be done. We're just scratching the surface here, but I think that to think that vitiligo is just a Th1-driven disease, I think we've gone past that now. So there may be other environmental inducers, such as house dust mite and other pollutants, that may be triggering flares in vitiligo. I'm not saying that it is the cause of disease, but it could be a potential environmental trigger that in a genetically predisposed individuals may be enough to trigger flares or exacerbation of their disease.
Even seborrheic dermatitis also?
Yes.
Yes.
So probably the mechanism of house dust is not necessarily antigen related or allergen related, but could be some pro-inflammatory mechanism. Could be.
Exactly. I think it's more of a pro-inflammatory mechanism rather than antigen.
Yeah, there are another couple of questions. Marwa?
Wonderful presentation, Meri. Have you tested patch tests against house dust mite in vitiligo patients? Because, they are positive in many cases of atopic dermatitis. So, have you reached this point
I would have
yet?
loved to have done that. And it's something that, it is something that we plan to do. What I can tell you is that when we have actually looked at, in the IBS study we've published now 5-6 years ago, we did look at the effect of house dust mite in IBS patients, and I did look at their associations with whether their responses were associated with house dust mite sensitivity, and we didn't find. any, so I can't say that that's the case for vitiligo patients,
We have
but
to test
certainly
it.
for IBS patients where house dust mite did play a role, there was no difference in responses or DERP1 immunoreactivity in house dust mite sensitized compared to non-sensitized IBS patients.
Thank you.
Okay.
Well, thank you for the brainstorming and upside down thinking. It's okay. But many studies, all the studies showed that the ecadrines are defective in vitiligo patients. So, I mean, is your hypothesis that all this is secondary, might be secondary, or maybe it's the reverse? Maybe the defect in the ecadrines makes the mites can live more easy in the skin, so that's why you find high counts. I mean, why it's not the reverse?
Well, we think that it may be the destruction that may be caused by house dust mite
Yes.
on these adherent junctions and not the tight junctions, so it's the adherent junctions,
Yes.
makes the melanocytes fly, if you like. Okay, so they're
Yeah.
present in the suprabasal epidermis. And then
Yes.
we've shown that they do undergo apoptosis. Now, I'm not sure which is the chicken and which is the egg,
Yeah.
but they certainly can have a direct effect by the secretome on their apoptosis and I assume subsequent
Yes,
death.
because this is an unusual reaction to the mites. I mean, reaction to mites is mainly allergic. Maybe I cannot just bind both of them together, but of course you might...
Actually, it depends which tissue you look at. If you
Yes.
look at the house dust mite response in the lung, yes, it is a Th2-driven immune
Yes.
response. That's clear. If you look at the house dust mite response in the gut,
Yeah.
it's Th17-driven.
Yes.
So in the skin, we have shown that house dust mite increases vitiligo-like
Yeah.
cytokines and chemokines. I did look at Th2 and I did see some activation of Th2 immunity,
Okay.
but nowhere near the levels that we see with, for example, CXCL9 and 10.
Yes, no, because I remember when we studied the ecadrine, the precursor, which was HS1, I don't even remember the name, was not present in vitiligo at all. So that's why we thought that the ecadrine defect is primary. I mean, because there is an inside factor that makes it defective.
The destruction of ecatherine has been well described now.
Yeah.
Julian Seneschal's group have shown
Yes.
in the same 3D model
Yeah.
that it is the destruction of ecatherine and the MMP9 activation that is lifting up these melanocytes.
Yes.
And here we're showing that one of the potential triggers
Might be, yes.
may be
Yeah.
house dust mite along with
Yes.
genetics and
Yes.
immune dysfunction and so forth.
Yes. Thank you.
Thank you.
Here, what is its action on house dust tenacin-X? Has it got any action on tenacin-X? And is it contributing for melanocytoregy?
Sorry, I didn't.
Could you repeat the question?
Yeah.
Can you
What is the
stand up
action
so we
of
can
house dust mite antigen on tenacin-X, which is responsible for melanocytoregy, where there is a detachment of melanocytes and they are destroyed?
So you're asking, if I understood correctly, what is the role of house dust mite on detachment?
Exactly.
Yeah.
On tenacin-X specifically.
We haven't looked at actual tenacin, but we know that the effect is dose dependent, so that the doses certainly that we looked at is the typical doses that are used in these kind of studies. The doses that we know are used specifically in the skin for keratinocyte work. As far as anything else, I'm not really, I can't answer that.
Okay, any role of ivermectin as a treatment modality? Topical or systemic ivermectin?
Good question. I don't know.
Thank you.
Thank you.
The last question? Yeah.
Okay, very interesting study, but does this have an actual clinical correlation? Do we have a proof for that, more people with bronchial asthma or atopic diathesis or all the atopic allergies, is it associated with vitiligo? We don't see actually this in real life. So where do you think the association in the etiology, in the etiopathogenesis comes here with the vitiligo?
There are reports which clearly show that there is comorbidity between atopic dermatitis and vitiligo, and also a number of reports showing correlation with asthma, and that the associations that have been done are, I have to admit, yes, they're mostly epidemiological associations. So there hasn't been mechanistic work to actually been able to show correlation between clinic and so forth. And I think very much those studies are needed to be done, but they're not in the literature, so.
Okay, thank you. Thank you very much for this talk.